Welcome back to the final segment of Healthcare Consumerism Radio. Joining us on this segment, we have Pearson Talbert, President and CEO of Aegis Health Group. Welcome to the program, Pearson.
Good morning. How are you?
We're doing well. How are you doing?
I'm very well today. Thank you for having me.
Yeah, of course. To start off, let's just get a little bit of background about Aegis Health Group.
Sure. So Aegis is a company that was founded back in 1989 in Brentwood, Tennessee, which is just a little bit south of Nashville. And we have worked with hospitals for the past quarter century or so, providing health management solutions in the name of marketing and business development, which have, of course, rapidly morphed over the past few years to focus heavily on population health management as hospitals and health systems are facing pressures to work more in the areas of chronic disease.
Do you, Pearson, good morning. This is Doug Field. Nice to have you here.
Thank you, Doug.
I mean, there's a lot of pressure being brought on by the ACA, and a lot of it very positive. I mean, aside from all the regulatory issues and those that's got to be worked out, I mean, I think the exciting thing we're seeing is a lot of innovation take place and a lot of good work get done, like what you're doing. There's a lot of question marks on population health and ROI, though. How are you helping hospitals embrace that?
Sure, and I could not agree more with you. Something obviously had to change with regards to the way we deliver health care in this country. The triple aim is, of course, a huge part of that. But for hospitals, which are businesses and health systems, if the return is not there, it doesn't make sense. I think a lot of that is yet to be determined as reimbursement changes from fee-for-service to pay-for-performance. Mm-hmm. Some of that is measurable today, though. With regards to outcomes, as hospitals and health systems push individuals further up in the care continuum. Some of our clients term that the velocity of value, if you will. It's a term that I'm particularly fond of. What we look at for our health system clients is the throughput with regards to not only outcomes, but obviously at the end of the day, they have to generate a return to keep their doors open. So we measure it for them in the areas of return on investment by looking at revenue that they're able to generate.
Hospitals, your primary customer, correct? Is that
correct?
It's your primary channel, but obviously looking on through to their patients and employers who have many of their employees as their patients. I think it's interesting the piece of space you have because we see, in our work across the country, a lot more hospitals turning to create these contractual relationship with private employers in their area.
Mm-hmm.
Do you see the same thing happening?
Yes, definitely. Our model, I describe it to folks the first time they hear it. You're never going to see it in an MBA textbook. And ours is really a B to B to C business model, whereas it's the health system to the employer, Doug, as you outlined, right, to the individual consumer. And that's where I would draw an important distinction. For us, it's really about hospitals relating to the communities that they serve. And it's not just about patients and patient data. Hospitals have patients today. Yeah. Our question that we try to answer, or the why are we in business question, really is about how does a health system that's known for providing sick care reach out to someone and have a relationship that they've never had before, meaning someone who's never been into their health system. Right. How do they create a relationship with them? And as you alluded to there, I'm going to kind of paraphrase that. I think you're asking me about narrow networks in regards to those contracts. Yeah. We're seeing a lot of that. One of our clients, a California-based client recently, I shouldn't say recently, but 2 years ago started the process to obtain their Knox-Keene license. Like most large employers, they were self-insured, and they said, this makes a lot of sense for us to offer our own health plan to other self-insured employers in our county. And I think you're going to see a lot more of that. Literally yesterday, I was in a board meeting and my phone lit up, and there was a modern healthcare alert that North Shore Long Island Jewish had just done the same thing. So I think you're going to see that trend continue. And I think they will move beyond narrow networks to, in some cases, exclusive provider networks. And I think it's the right thing. I really do, because when the same entity is bearing the risk that is responsible for the outcomes, then you really have the financial incentives aligned to deliver a better patient experience, a better population experience, and a reduced per capita cost.
Yeah, so as we get more and more hospitals aware and health systems aware that that is a distinct opportunity for them with, private employers in their area of coverage, and you've got private employers that have a lot of pressure on them to improve costs, get, their health care benefits, and cost, aligned, their population healthy. They're becoming more innovative and reaching out and looking at these type of relationships. I think it's a win-win in the right situations.
Yeah, I could not have said it better myself. In our experience, that's where we see the highest performing organizations having the best outcomes, whether that's a traditional sick care outcome, or if you want to talk about wellness or health improvement, however you want to term that. You're going to have a better outcome the sooner you're able to put someone into the care continuum, right? It's just logically speaking that if I'm a cardiologist, for example, I'm probably going to have a better outcome if I can educate somebody today versus putting a stent in them tomorrow versus treating a heart attack that I was not expecting to happen the day after that versus a heart transplant. And so the further you can get to someone in their life and make an intervention, the better outcome you're going to have.
How do you help? There in a lot of instances, there's a lot of fear in the consumer populations to specifically hospitals, and that kind of permeates on up to the employer leadership too. And then it's compounded when you look at Leah's survey work at hospital safety scores at the Leapfrog Group. How do you help your health systems kind of embrace that and deal with that as they're, broadening their, footprint with employers and consumers?
Yeah, excellent question. We tend to think, particularly, my generation of the 40-plus, God, that makes me sound old.
Hey, listen, Pearson, I'm a grandpa, so does that make you sound younger? There you go. I can't believe I am, but I am. So.
I used to think, hey, Generation X, that was great, and now it's all about the millennials, right? But all kidding aside, those of us over 40, I think we tend to think of hospitals historically as places you go when you're sick or when you're chronic, or that's where people who are terminal go. It couldn't be further from the truth today. So many of our health system clients, and I say health system in purpose, most of our all of our health system clients, whether they are operating a traditional standalone hospital or they have multiple hospitals in their system, they've all branched into additional ancillary service lines. It started years ago with surgery centers and then diagnostic testing facilities, and you're seeing this rapid expansion into primary care, patient-centered medical home models, clinical integration, and that's outstanding. But I'm even starting to see it go even further than that with fitness facilities and wellness facilities or health improvement facilities, again, however you want to term that industry. And it's the right thing to do because at the end of the day, it's about improving someone's health status, and that's how they're winning the hearts and minds, if you will, of not just come to us in an ambulance, but, hey, come here voluntarily because we have great workout equipment or we have great nutritionists on staff. And I'm starting to see this kind of Malcolm Gladwell tipping point moment, if you will, in the health system industry.
Can you share with our audience some examples of some health systems that are doing this right now?
Yeah, absolutely. At the risk of alienating any of my clients, I'm not going to name them all because we work with about 100 different hospitals and health systems across the U.S., but I'll pick a few out. So Baptist Health System down in Birmingham, Alabama is a great one. St. Vincent's in Jacksonville, Florida, Summa Health System, Chomp, the community hospital in the Monterey Peninsula, has an incredible workout facility and a fitness facility that they established a couple of years ago that Literally, when you walk in and you swipe in, the facility knows you're there. You sit down on the machine, you swipe your badge, and your everything moves to fit you, almost like a smart car. It's amazing what health systems are doing these days. And I think you're going to see this proliferation continue, and it's the right thing to do for their communities. And I want to bring it back to that because at the end of the day, they are central to their communities. They're large businesses. They most often, their CEOs or somebody in their leadership sits on their chamber of commerce. They care. Mm-hmm. They're not located thousands of miles away. They're not serving other communities by and large. They're there, and they always will be there.
Mm-hmm. I think the ACA is driving a lot of change. One thing that we talk about a lot is the tie-in to reduction in health premiums, to participation in wellness incentives, and how do your health system clients, how can they take advantage of that?
Absolutely. If you think about the health system being at the center of an individual's life, and we'll just assume an employee to population because the ACA addresses a lot of that, right, with incentives management and what you can and cannot do. Would you rather have a health system controlling that data, a payer controlling that data, or, quote, a national wellness vendor controlling that data? Mm-hmm. My belief is this, that the health systems can do the employers in their market a great service by managing whatever incentives a employer wants to offer to incent the right behavior towards a particular health-related outcome. Mm-hmm. And I think that data needs to live there primarily because employers are going to change health plans repeatedly. It's the nature of the game. Whoever offers the best premium for that year usually wins the business. So when that happens, there's an immense loss of data on individuals between payers. But if a health system is the holder of that data and can manage the incentives regardless of whatever they are for an employer, that just makes an inordinate amount of sense to me. Fortunately, the ACA encourages a lot of that. And so anyway, I'll kind of quit talking on that point if there's a follow-up question to it, because I am from Alabama and I do have a tendency to ramble on.
Well, we're about done here today, Pearson. We got about 30 seconds to go, and I really, really appreciate your time. And I think this is, what you're doing just is another example of the innovation that's taking place in this space, and, what you're doing with your health systems clients and what you see them doing. So I appreciate you being with us, and if you can close by leaving a way our audience get in touch with you, I'd appreciate it.
Sure. So I would direct any audience members that are interested in learning more about what Aegis Health Group does, either to our regular website at aegisgroup.com, which is AEGIS group.com, or our One Community site, which is in front of what'sahead.com. And feel free to read more about us. And, of course, you can always give us a call at 615-665-4200.
Thanks, Pearson. You have a great weekend up there. And
thank you, Doug.
To our audience, thanks for joining us on this segment of Healthcare Consumers Radio, and we'll see you next week. Thanks.